Peripheral neuropathy with diabetes. A production of GoodHealthTube.com. The term neuropathy is used to describe several types of nerve damage. In people with diabetes, there are essentially 4 types of diabetic neuropathy. It is important to note that when we are dealing with diabetic neuropathy, we are talking about diabetes-related nerve damage in the peripheral nervous system. The peripheral nervous system is the set of nerves outside of the central nervous system. The central nervous system consists of the brain and spinal cord. For the remainder of this video, we will equate diabetes-related peripheral neuropathy as diabetic neuropathy, which is a type of peripheral neuropathy. Make sure you watch our other video entitled What is Peripheral Neuropathy, which is in our neuropathy playlist. There will be a link in the description, and you can find out what are some other causes of neuropathy besides diabetes. We will now delve deeper in the 4 types of diabetic neuropathy that often afflict people with diabetes. Complications of each kind of diabetic neuropathy will also be discussed, as well as diagnosis and treatment. We will also discuss later in this video how to mitigate or prevent diabetic neuropathy. The 4 types of diabetic neuropathies are as follows: 1. Peripheral neuropathy, 2. Autonomic neuropathy, 3. Proximal neuropathy, and 4. Focal neuropathy. We will now focus on each type of neuropathy one at a time. 1. Peripheral neuropathy. Diabetic peripheral neuropathy usually affects the feet and legs, but it can also affect the arms or hands. Symptoms are varied and can be mild to severe. They include numbness, tingling or burning sensations, early symptoms, shooting pain or a sharp pain, extreme sensitivity to touch causing severe pain, insensitivity to hot and cold temperatures, cramping, muscle weakness, and loss of coordination, making it difficult to control movement and causing difficulty walking. Some people feel pain more often at night, and each of these symptoms can be a significant diabetes complication affecting the quality of life. There can be severe shooting pains and sharp pains and chronic pain from the nerve damage. These pains have been known to lead to depression and even suicide in people with diabetes. If you have diabetic peripheral neuropathy, you may not feel an injury or sores on your foot. Moreover, damage to the small blood vessels in your feet from a high blood sugar contributes to poor blood flow and poor wound healing. This is one of the main reasons for foot problems and infections and the subsequent need for amputation in diabetics. This is a common complication which can be mitigated or avoided by an early diagnosis. Diabetics must check their feet on a daily basis and care for wounds immediately to prevent the development of a foot ulcer and the need for amputations. 2. Autonomic neuropathy. This is the second most common type of diabetic neuropathy, or more specifically, is known as autonomic diabetic neuropathy. This type of neuropathy can affect nerves in some of the internal organs. The autonomic nervous system is part of the peripheral nervous system and regulates other systems in your body over which you do not have complete conscious control. These body systems include your digestive system, cardiovascular system including the control of blood pressure, the genital urinary system involving bladder and sexual organs, and the system involving your ability to sweat. The complications diabetic neuropathy causes from an autonomic perspective include low blood pressures, dizziness, fainting episodes, and a labile heart rate. A blood pressure that is too low can cause fainting. Digestion problems from autonomic diabetic neuropathy. Nerve damage to the digestive tract can manifest as nausea, vomiting, diarrhea and subsequent dehydration. Constipation, dysphagia, which is difficulty swallowing, and gastroparesis, which causes the stomach to empty too slowly into the small intestines. The cumulative effect of these digestive system symptoms can make it all the more difficult to control and manage one's blood sugar, often resulting in high blood sugar levels. Obtaining adequate nutrition is also problematic. Blood glucose monitoring is of vital importance when experiencing this type of neuropathy. Sweating problems and autonomic diabetic neuropathy. Symptoms such as sweating and heart palpitations can go undetected in people with autonomic diabetic neuropathy. This can mean not noticing when you have low blood sugar, hypoglycemia unawareness, or a high blood sugar. This is why blood sugar levels must be monitored closely. Furthermore, the impaired sweat glands can lead to difficulty in body temperature regulation. Sex organs and bladder problems. Diabetic autonomic neuropathy may also cause sexual dysfunction such as erectile dysfunction and vaginal dryness. Diabetic autonomic neuropathy can cause urinary incontinence, or make it difficult to fully empty your bladder. This abnormal bladder function is also known as a neurogenic bladder. This can lead to urinary tract infections, and the infections themselves can lead to a high blood glucose level. Cardiovascular problems. Damage to the nerves that control your heart rate and blood pressure can make them respond more slowly. You may experience a drop in blood pressure and feel lightheaded or dizzy when you stand up after sitting or lying down, or when you exert yourself. Autonomic diabetic neuropathy can also cause an abnormally fast heart rate. Diabetic autonomic neuropathy can make it difficult to identify some of the symptoms of a heart attack, such as chest pain and cold sweats. You may not feel any chest pain when your heart isn't getting enough oxygen. Diabetes is one of the most important risk factors in heart attacks. 3. Proximal neuropathy. In addition to peripheral and autonomic neuropathy, the third kind of diabetic neuropathy is proximal neuropathy. This is a kind of diabetic neuropathy also known as diabetic amyotrophy. This form of neuropathy is more common in adults over 50 years old with type 2 diabetes and is diagnosed more often in men. It often affects the hips, buttocks, or thighs. You may experience sudden and sometimes severe pain. Muscle weakness from nerve damage in your legs may make it difficult to stand up without assistance. Diabetic amyotrophy usually affects only one side of the body. After the onset of symptoms, they usually get worse and then eventually begin to improve, but only slowly. Most people recover after many months. 4. Focal neuropathy is the fourth kind of diabetic neuropathy. Focal neuropathy, otherwise known as mononeuropathy, occurs when there is nerve damage to one specific nerve or group of nerves, causing weakness in the affected area. This is in contrast to diabetic polyneuropathy, which affects multiple sensory and motor nerves. This singular type of nerve damage occurs most often in the hand, head, torso, or leg. It appears suddenly and is usually very painful. Symptoms depend on the individual as there is much variation from individual to individual. Like proximal neuropathy, most focal neuropathies go away in weeks to months and leave no lasting damage. The most common type is carpal tunnel syndrome, which involves nerve compression in the wrist. Diabetics are more prone to carpal tunnel syndrome, which is damage to a single nerve in the wrist. Symptoms of this kind of neuropathy include pain, numbness, tingling in fingers, double vision, aching behind the eyes, Bell's palsy, which is paralysis of the facial muscles, typically on one side of the face, pain in isolated areas such as the front of the thigh, lower back, pelvic region, chest, stomach, inside the foot, outside the lower leg, or weakness in the big toe. What causes diabetic neuropathy? Diabetic neuropathy is nerve damage caused by high blood sugar levels sustained over a long period of time. Other factors can lead to nerve damage, such as damage to the blood vessels caused by high cholesterol levels, mechanical injury from trauma, lifestyle factors such as smoking, and alcohol use, which can contribute to painful diabetic peripheral neuropathy. Another important factor to consider in diabetic neuropathy is low levels of vitamin B12. Metformin, a common medication used to manage diabetes, can decrease levels of vitamin B12. You can ask a doctor for a simple blood test to identify any vitamin B12 levels. B12 supplementation can sometimes reverse nerve disease. How is diabetic neuropathy diagnosed? A doctor will determine whether or not you have neuropathy by asking about your symptoms and medical history. You'll also have a clinical examination and be checked for your level of sensitivity to temperature and touch, heart rate, blood pressure, and muscle tone. All of these tests can assess nerve damage. A physician will check your limbs for any loss of sensation. A tuning fork may be used to test your vibration threshold. A doctor may also test your ankle reflexes. In some cases, they may also perform nerve conduction studies, which can assess nerve damage by measuring the speed and strength of nerve signals. Can I prevent diabetic neuropathy? Diabetic neuropathy can often be avoided if you manage your blood glucose vigilantly. To do this, be consistent in monitoring your blood glucose levels, taking medications as prescribed, eating a healthy diet, being active, and quit smoking. If you do develop diabetic neuropathy, work closely with a doctor and follow their recommendations for slowing its progression by managing your blood glucose. With proper care, you can reduce the damage to your nerves and avoid complications such as pain, infection, and amputation. How is diabetic neuropathy treated? There are several medications that can be used to treat people with diabetes and manage pain. Pregabalin, Lyrica, gabapentin, Neurontin, duloxetine, Cymbalta, venlafaxine, Effexor, and amitriptyline. Other suggested treatment options may include topical medications, like capsaicin and transcutaneous nerve stimulation. The type of treatment, particularly in managing pain, is dependent on the affected nerves and the type of nerve damage. Controlling blood glucose levels is a highly effective way of reducing symptoms and the progression of neuropathy. Managing your glucose levels should always be a part of your treatment plan, as this can possibly prevent or delay diabetic neuropathy. A recent discovery of an enzyme in neuropathy does have significant implications in approaching neuropathy. See the link in the description or the pinned comment below. Let's now recap the contents of this video. There are 4 types of diabetic neuropathy: peripheral diabetic neuropathy, autonomic diabetic neuropathy, proximal diabetic neuropathy, and focal diabetic neuropathy. Peripheral and autonomic neuropathies are the most common diabetic neuropathies. These often result in burning and tingling pains as well as muscle weakness and cramping. Peripheral neuropathy makes diabetics prone to infections, particularly in the feet. Autonomic diabetic neuropathy affects internal organs, typically those of the digestive tract, cardiovascular system, and the sweat glands of the skin. Diabetic neuropathy is caused by uncontrolled elevated blood sugars. You can mitigate and possibly prevent diabetic neuropathy by being vigilant about your blood sugar levels. Diabetes-related nerve damage is diagnosed by having a clinical exam by a physician who can perform specialized tests. Treatment of diabetic neuropathy involved several types of pharmaceuticals. There is, however, a discovery of a certain enzyme that has profound implications of relieving pain and nerve damage. See the description link or the pinned comment below to learn more on how this discovery can help you. Please like, subscribe, and comment. More valuable videos such as this are in the pipeline, which you can watch in our neuropathy playlist. Hit the notification bell to be notified when more videos become available. This video is not a substitute for consulting a physician. It is not intended as medical advice. It is intended solely for educational and informative purposes. Always consult a healthcare professional before beginning a new health plan. You have been watching a production of GoodHealthTube.com. Thanks for watching.